What if I told you that most men over 60 are unknowingly making 5 critical mistakes every single day that are slowly destroying their prostate health? These are not complicated medical procedures or expensive treatments. These are simple, everyday choices that either protect or damage one of the most important glands in your body. Right now, as you watch this, your prostate is either getting stronger or weaker based on what you did today. I am Dr. Eva Hart, a certified urologist with 14 years of specialized experience working with men over 60. In my practice, I have seen thousands of men struggle with prostate issues that could have been prevented with the right knowledge. What I am about to share with you today is not theory. It is proven science that has already transformed the lives of countless men who thought their best years were behind them. I know this topic makes many men uncomfortable. We are taught to suffer in silence, to accept declining health as inevitable, to never discuss what is happening to our bodies. But that silence is what is hurting you most. The embarrassment, the shame, the feeling that you are somehow less of a man because your body is changing, none of that helps you heal. What helps is honest, straightforward information that you can act on immediately. In this video, I will reveal 5 daily habits that can dramatically improve your prostate health after 60. These are not expensive supplements or complicated procedures. These are simple, natural approaches that work with your body, not against it. Each habit builds on the others, creating a comprehensive strategy for maintaining strength, vitality, and confidence as you age. This is about more than just physical health. This is about reclaiming your identity as a man, your confidence, your quality of life. This is about refusing to accept that getting older means getting weaker. Your masculinity, your vitality, your sense of control over your own body, all of this can be restored naturally. Stay with me until the end because what I share in the final minutes could be the missing piece that changes everything for you. And if this topic resonates with you, share in the comments what exactly speaks to you. If it does not, let me know how I can improve the content and what topic would be more interesting for you. But before we dive into these 5 habits, you need to understand something that most doctors will never tell you about what happens to your prostate after 60, and why the conventional approach is failing so many men. Your prostate is about the size of a walnut, sitting just below your bladder and surrounding the tube that carries urine out of your body. This small gland produces fluid that helps transport sperm, but after age 50, something concerning begins to happen. Prostate starts to enlarge, and this enlargement affects more than half of men between 51 and 60. For 70, that number jumps to over 80%. This condition is called benign prostatic hyperplasia, and while the word benign sounds harmless, the effects on your daily life are anything but harmless. As your prostate grows, it squeezes that urinary tube like a clamp, making it increasingly difficult to empty your bladder completely. This leads to a weak urine stream, that constant feeling that you cannot fully empty your bladder, difficulty starting urination, and those frustrating trips to the bathroom that interrupt your sleep multiple times each night. Here is what most men do not realize. This enlargement is not inevitable. The rate of growth, the severity of symptoms, and the impact on your quality of life can all be significantly influenced by your daily habits. Yet most doctors focus on managing symptoms rather than addressing the underlying factors that contribute to prostate enlargement in the first place. Traditional approach waits until symptoms become severe, then offers medications with side effects or surgical procedures. But what if you could prevent or slow this enlargement naturally? What if you could maintain prostate health using simple, everyday habits that cost nothing and have no negative side effects? That is exactly what these 5 habits accomplish. They work by reducing inflammation, improving circulation, supporting hormonal balance, and providing your prostate with the nutrients it needs to function optimally. Let me show you how each one works. The first habit that can transform your prostate health is strategic hydration, but this is completely different from what most men think they know about drinking water. As we age, our sense of thirst diminishes significantly. Many men go for hours without drinking water, then try to compensate by drinking large amounts at once, especially in the evening when they finally remember to hydrate. This creates a cascade of problems for your prostate. When you do not drink enough water throughout the day, your urine becomes concentrated and acidic. This concentrated urine is loaded with toxins and waste products that irritate your bladder and inflame your prostate tissue. Think of it like trying to clean a dirty surface with a strong acid. It creates more irritation and damage than healing. Additionally, when you drink large amounts of water late in the day, you guarantee those frustrating nighttime bathroom trips. Your bladder fills up while you are trying to sleep, creating pressure on your already sensitive prostate and disrupting the restorative sleep your body needs to heal. Strategic hydration solves both problems. The approach is simple but powerful. Drink adequate water consistently throughout the morning and early afternoon, then taper off your fluid intake in the evening hours. This keeps your urine diluted and less irritating to prostate tissues while allowing you to sleep through the night without constant interruptions. Research published in the Journal of Urology involving over 2,000 men over 60 demonstrated the power of this approach. Men who followed strategic hydration patterns experienced up to 41% reduction in nighttime urination episodes and incomplete bladder emptying sensations. They reported better sleep quality, less daytime fatigue, and reduced anxiety about finding bathrooms when away from home. Practical application is straightforward. Start your day with a full glass of water as soon as you wake up. This helps your body begin the natural detoxification process after hours without fluid intake. Throughout the morning and early afternoon, sip water consistently rather than drinking large amounts at once. Through 6 p.m., limit your fluid intake to just small sips if you feel thirsty. This one change costs absolutely nothing but can dramatically improve your sleep quality and reduce prostate irritation within just a few weeks. Your body will thank you with more restful nights and more confident days. But hydration alone is not enough. The second habit addresses something that happens every single time you eat, and most men have absolutely no idea how much this affects their prostate health. The second habit is taking a light walk after your main meals, and the science behind this simple practice is remarkable. When you eat and then sit still for extended periods, blood flow to your pelvic region becomes sluggish. Your prostate, like every organ in your body, depends on fresh blood flow to deliver oxygen and nutrients while removing toxins and inflammatory compounds. Sitting immediately after eating creates a perfect storm for prostate problems. Your body is working to digest food, which requires significant blood flow to your digestive system. Meanwhile, your prostate and other pelvic organs receive reduced circulation. This environment allows inflammatory substances to accumulate while limiting the delivery of healing nutrients and oxygen. Just 10 to 15 minutes of gentle walking after lunch and dinner completely changes this dynamic. The movement activates circulation throughout your pelvic region, sending fresh, oxygen-rich blood directly to your prostate tissue. This improved circulation helps flush out inflammatory toxins while delivering the nutrients your prostate needs for optimal function. Walking after meals also provides crucial blood sugar control, which directly impacts prostate health. When blood sugar spikes after eating, it triggers inflammatory responses throughout your body, including in prostate tissue. The gentle movement helps your muscles utilize glucose more effectively, preventing these inflammatory spikes. Research conducted at the University of São Paulo followed men over 65 for several years and found remarkable results. Those who walked for just 15 minutes after their main meals had a 35% lower risk of developing moderate to severe prostate enlargement symptoms compared to men who remained sedentary after eating. The lymphatic system also benefits significantly from post-meal walking. Your lymphatic system is responsible for removing cellular waste and inflammatory compounds from tissues. Unlike your circulatory system, the lymphatic system has no pump. It relies on muscle movement to function effectively. The gentle muscle contractions during walking help your lymphatic system clear inflammatory substances from prostate tissue. You do not need a gym membership, special equipment, or intense exercise. A simple walk around your house, down your street, or even pacing in your living room provides these benefits. Key is consistency and timing. Make this walk as automatic as brushing your teeth after meals. Many of my patients report that this habit not only improves their prostate symptoms but also enhances their digestion, energy levels, and overall sense of well-being. Your prostate will thank you with improved function and reduced inflammation, often within just a few weeks of consistent practice. Now, the third habit might surprise you because it involves something many men over 60 avoid discussing, even with their doctors. But the science is absolutely clear, and the benefits are too important to ignore. The third habit is maintaining regular sexual activity, and I understand this topic makes many men uncomfortable, especially as they age. There are cultural taboos, performance anxieties, and outdated beliefs about sexuality after 60. But from a purely medical standpoint, regular intimacy is one of the most effective natural ways to protect and maintain your prostate health. Your prostate continuously produces secretions as part of its normal function. These secretions, along with dead cells and metabolic waste products, can accumulate in the gland over time. Regular ejaculation acts like a natural cleansing system, helping to flush out these accumulated materials that can contribute to inflammation, enlargement, and even cellular changes that may lead to cancer. This is not just theoretical, this is backed by extensive research. The Harvard School of Public Health conducted one of the largest studies on this topic, following over 10,000 men for 2 decades. The results were striking. Men who ejaculated at least 21 times per month had a 33% lower risk of developing prostate cancer compared to men who ejaculated less frequently. Beyond the cleansing effect, sexual activity provides multiple other benefits for prostate health. It improves blood circulation to the entire pelvic region, delivering fresh nutrients and oxygen to prostate tissue. The physical activity releases stress-reducing hormones and promotes better sleep quality. The hormonal changes associated with regular sexual activity help maintain healthier testosterone levels and reduce cortisol, both important for prostate health. Many men over 60 struggle with confidence in this area, often due to physical changes, medication side effects, or psychological factors. Performance anxiety becomes a self-fulfilling prophecy, leading to avoidance and further decline. But maintaining an active intimate life, whether with a partner or through self-care, is a legitimate medical recommendation for prostate health. If you experience difficulties with sexual function, please do not suffer in silence. There are many effective treatments available, from lifestyle modifications to medical interventions. Your prostate health depends on this natural cleansing process, and there is absolutely no shame in taking care of your body in this way. The important point is regularity rather than intensity. Your prostate benefits from consistent, gentle cleansing rather than infrequent activity. Work with your healthcare provider to address any obstacles to maintaining this important aspect of prostate health. The fourth habit transforms something you already do 3 times a day into powerful medicine for your prostate. Most men eat without any awareness of how their food choices directly impact their prostate health, but certain foods contain specific compounds that can dramatically influence prostate function. The fourth habit involves strategic nutrition that specifically targets prostate health and protection. Your daily food choices either fuel inflammation and abnormal growth or provide powerful compounds that reduce inflammation, slow enlargement, and help prevent cellular changes that could lead to cancer. Lycopene stands out as one of the most powerful prostate-protecting compounds available in food. This natural antioxidant gives tomatoes, watermelon, and guava their vibrant red color, but more importantly, it has been shown to accumulate specifically in prostate tissue where it provides targeted protection against inflammation and abnormal cell growth. Here is the crucial detail most men miss. Your body absorbs lycopene much more effectively from cooked tomatoes than raw ones. When tomatoes are cooked in oil, as in tomato sauce, tomato paste, or tomato soup, the lycopene becomes more bioavailable and your body can utilize it more effectively. Research published in the International Journal of Cancer showed that men who consumed cooked tomatoes at least twice per week had a 28% lower risk of developing prostate cancer. Zinc represents another crucial nutrient for prostate health. Your prostate contains higher concentrations of zinc than any other organ in your body, and zinc deficiency is directly linked to prostate enlargement and inflammation. As men age, zinc absorption often decreases while zinc needs may actually increase. Pumpkin seeds are one of the richest food sources of bioavailable zinc. Just a handful daily can provide significant prostate protection. Other excellent sources include nuts, especially Brazil nuts and almonds, and seafood like oysters and sardines. Cruciferous vegetables deserve special attention for prostate health. Broccoli, cauliflower, cabbage, Brussels sprouts, and kale contain unique compounds called sulforaphanes that help your body detoxify harmful substances and prevent cellular damage in the prostate. These vegetables literally help your body fight off toxins and carcinogens that could damage prostate tissue. Key is eating them regularly. Aim for at least one serving of cruciferous vegetables daily. Green tea provides another layer of prostate protection through compounds called catechins, particularly one called epigallocatechin gallate or EGCG. These powerful antioxidants concentrate in prostate tissue and have been shown to reduce inflammation and slow abnormal cell growth. Drinking 2 to 3 cups of green tea daily provides measurable protective effects. Caffeine is a concern. Decaffeinated green tea still contains these beneficial compounds. Omega-3 fatty acids from sources like wild-caught salmon, sardines, walnuts, and flax seeds help regulate inflammation throughout your body, including in prostate tissue. These healthy fats also support hormone production and balance, which becomes increasingly important for prostate health as testosterone levels naturally decline with age. The goal is to make every meal an opportunity to protect your prostate. Include colorful vegetables at each meal, with special emphasis on cooked tomatoes and cruciferous vegetables. Add nuts or seeds for zinc and healthy fats. Choose lean proteins and include omega-3 rich fish several times per week. When you eat strategically, food becomes medicine that works 24 hours a day to protect your prostate. But even the best nutrition cannot overcome the damage caused by poor sleep. The fifth habit addresses something that happens every single night and has a profound impact on your prostate health. The fifth habit is optimizing your sleep for hormonal balance and prostate protection. Quality sleep is not a luxury or something nice to have. It is essential medicine for your prostate. During deep sleep phases, particularly the deepest stages of non-REM sleep, your body produces critical hormones like melatonin and growth hormone that have powerful anti-inflammatory effects specifically on prostate tissue. Melatonin, produced by your pineal gland during darkness, is not just about regulating sleep cycles. Research has shown that melatonin acts as a powerful antioxidant in prostate tissue, protecting cells from damage and reducing inflammation. Men with chronic sleep problems often have significantly lower melatonin production, leaving their prostates more vulnerable to inflammatory damage. Growth hormone, released during deep sleep, plays a crucial role in tissue repair and regeneration. Your prostate, like all organs, undergoes constant cellular renewal and repair processes. Without adequate deep sleep, these repair mechanisms cannot function effectively, leading to accumulated damage over time. When sleep is disrupted, shallow, or insufficient, these protective hormonal cycles break down completely. Stress hormones like cortisol increase, inflammation rises throughout your body, and your prostate becomes increasingly vulnerable to damage and disease. Research published in Cancer Epidemiology, Biomarkers and Prevention tracked over 2,400 men for nearly a decade and found that those with chronic sleep problems had twice the risk of developing aggressive prostate cancer. Poor sleep also disrupts testosterone production in a cascade effect that impacts prostate health. Testosterone is primarily produced during deep sleep phases. When sleep quality declines, testosterone levels drop while cortisol levels increase. This hormonal imbalance creates an environment that promotes prostate inflammation and enlargement. Sleep fragmentation, common in men over 60, can be particularly damaging. Even if you spend 8 hours in bed, if your sleep is constantly interrupted by bathroom trips, stress, or other factors, you may not be getting adequate deep sleep phases. This fragmented sleep pattern fails to provide the hormonal benefits your prostate needs. Creating consistent sleep habits provides protection for your prostate every single night. Go to bed and wake up at approximately the same time daily, even on weekends. This helps regulate your circadian rhythms and optimize hormone production. Keep your bedroom cool, ideally between 65 to 68 degrees Fahrenheit, as cooler temperatures promote deeper sleep phases. Create complete darkness in your sleeping environment. Even small amounts of light can disrupt melatonin production. Consider blackout curtains or an eye mask if necessary. Remove electronic devices or use blue light blocking glasses in the evening, as blue light suppresses melatonin production. If you wake frequently to urinate, remember that strategic hydration habit. Limit fluid intake after 6 p.m. and ensure you empty your bladder completely before bed. Sometimes what feels like a full bladder at night is actually just irritation from concentrated urine. Quality sleep is not just about feeling rested the next day. Every night of deep restorative sleep is actively protecting your prostate, reducing inflammation, supporting tissue repair, and maintaining the hormonal balance your body needs to keep your prostate healthy as you age. These 5 habits work together as a comprehensive system for prostate protection. Strategic hydration reduces inflammation while supporting better sleep. Post-meal walks improve circulation and hormone balance. Regular intimacy provides natural cleansing and stress relief. Strategic nutrition supplies targeted protection against damage and disease. Quality sleep supports hormonal balance and allows your body to repair and regenerate prostate tissue. Your prostate health is not determined by age alone, it is determined by the choices you make every single day. You have far more control over your prostate health than most men realize. These habits work because they address the root causes of prostate problems rather than just managing symptoms. Start with the habit that feels most manageable and build consistency over 2 weeks before adding the next one. Within 2 months of implementing these habits, most men notice significant improvements in urinary flow, reduced nighttime interruptions, and a greater sense of control over their bodies and their health.